Hello, everybody, and welcome to iHLS Innotech International Conference. In this segment, we'll discuss the delicate balance between fighting a colossal crisis such as the COVID pandemic and health privacy. What comes first? We have two distinguished ladies here. Hello.
Hello, Yaakov.
Hi. Sharon, introduce yourself.
Hello, Yaakov. My name is Brigadier General Sharon Nir. I am the former commander of cyber and the communications school at the IDF. And I also was the gender advisor to the chief of staff. Nice.
IDF, Israeli Defense Forces. Liora?
Hi, I'm Liora. In the past 2 months, I'm the VP in Digital and Technology at Clalit Health Centers. Prior to that, I was the CIO of Tel Aviv Municipality for 10 years. And prior to that, I was a member of the IDF, like Sharon here.
Okay. And remotely from New York joins us Amir. Hello, Amir. Hello, New York.
Hey, Yaakov. Good morning, good afternoon. I'm Amir, the CEO and founder of Carbyne.
That was a very short introduction. What do you do?
We're building advanced emergency collaboration systems for cities and governments to be able to communicate better with their citizens in emergency and non-emergency situation. For example, the city of Tel Aviv are using our solution for communication, the Israeli Fire Department, and 911 agencies around the world to better communicate with their citizens.
Okay, great. So it's going to be first name basis from now on. Okay, Liora, let's start with you. Health versus privacy. Mm-hmm. This is the question. How do you see it?
First of all, I understand there's a fine line between privacy and doing actions in order to stop the pandemic. But let me first describe what the pandemic has done to the health services. First of all, I think it was really a disruptive operation, because what happened is that all the encounters, all the meetings between doctors and patients have moved from the clinic to the house of the patient. For instance, in the last month, we have 50,000 encounters, virtual encounters, during regular hours and 50,000 during late hours. So you can see there is a shift of the mind to the doctors and to the patient.
Obviously, remote health is on the rise, and maybe this is the upside. What is the downside?
The downside, of course, is privacy. Not only in giving the medicine or giving the treatment, because the encounter could be a safe one. And even if we are talking about telemedicine and the ability to monitor you from your home, and we have devices like that, like the Taito that we have in Clalit, you are able to secure the connection and secure the data. I think the great danger is what is done on the level of the government in order to stop the spreading of the epidemic. There really lies the danger of privacy.
Mm-hmm. Amir, talk to us about not health risks, but security risks here and privacy risks.
Yeah, so I think obviously when everything moved to work remotely, this exposed the entities and people to a new level of security danger, I would say, because of the fact that now we are all using our Wi-Fi in order to be able to share very sensitive information, comparing to before when we used to attend to the healthcare physical spaces where you can take in consideration much more restricted policies in terms of security and data compliances, etc. So when everything is now moving into Wi-Fi infrastructure or home infrastructure, which is obviously much less secure, it's exposed to new risks where unknown entities can basically very easily, I would say, tap into your home internet and start to get access to very sensitive information that before you used to share only in closed rooms with your doctors in a very secure and sometimes not open to the world networks.
Yeah, and also now governments are exposed to a lot of information that maybe they were not exposed to before. This is something that could, easily tempt people to do stuff in government.
Yeah, no doubt. And I think one of the things that we saw in our industry is that a lot of governments are, suddenly so kind of, there is a mirror in front of their face. What am I doing now when I need to have my workers work from home? How do I do it? I'm not using cloud infrastructure. How I'm leveraging all the new technologies that are out there for 7, 8, 10 years. And I need to be now, use them, but I'm not ready to. So we saw a lot of shift from on-premise, wire-based solutions into, work from home kind of stuff. And I think governments are adapted pretty quickly. And I think in the long term, it will do very good for the global readiness for the next pandemic that might come in the future.
So you're optimistic. You see the upside. Sharon?
I think that, as we heard, the pandemic is really an accelerator to digital transformation, as we see and as we heard. But the most challenge things is to know how to collect a lot of data, important data, health data, and also to keep the patient privacy. It's a tension that we have to deal and to balance very good. I think that we can do it by use new analytic systems based on permissions and not to lose the patient
privacy.
Privacy, of course.
Yeah. So, Liora, how are you going to do it? You obviously are moving more into telemedicine. You have a lot of applications now and softwares and data. How are you going to protect it?
First of all, we have to change our architecture because we have to use the cloud in order to collect the data from all the patients. We have ruling of how to react in the cloud, how to monitor the data, how to see any change of the data, and so on. But it's a really different architecture than we had a year ago. So the movement to the cloud, the movement to the telemedicine world makes us really change the systems that we already have.
Yeah, a delicate balance. I thank you very much. Health, privacy. We'll see you in the next segment here at Innotech.